Hello friends, welcome to our channel. Today we are discussing about iron deficiency anemia. Anemia means loss of RBCs from the body which lead to the lack of oxygen in the body, called anemia. Iron deficiency anemia. Globally 50% of anemias are due to the iron deficiency. Iron is required for the RBCs formation also. That deficiency causes anemia. 8.4 lakh deaths annually due to iron deficiency anemia. 71% of deaths due to iron deficiency anemia are in Africa and Asian countries. Most common cause of anemia is iron deficiency. Second most common cause of anemia is anemia due to the chronic diseases. Iron deficiency anemia is a type of anemia where total body iron is reduced. Lack of iron leads to iron deficiency anemia in the body. Anemia is reduction in the number of RBCs, red blood mass, or their oxygen carry capacity that is needed to meet the metabolic need of body tissue. RBCs carry hemoglobin in which oxygen are carried by hemoglobin. RBCs reduces directly proportional to the hemoglobin reduction, which lead to the oxygen reduction in the body. Oxygen is required for the oxidative reactions or many metabolic reaction in the body. That's why iron deficiency anemia is lethal cause of death. Iron deficiency anemia is a type of anemia where iron supply to marrow is decreases. Marrow means red bone marrow, where the RBCs are formed in the body. It is present in the bones, long bones in our body. That iron supply to marrow is decreases, that leads to iron deficiency anemia or decreased production of RBCs. Total body iron is decreases. Three parameters are used to define anemia. At the level of hemoglobin, hematocrit percentage or RBCs count. Hemoglobin level. Classification of anemia. Microcytic anemia MCV is less than 80 FL. Normocytic anemia where MCV is 80 to 75 FL. Macrocytic anemia where MCV is greater than 95 to 100 FL. Some define microcytic is greater than 100 FL. It is not important for our study. Cause of microcytic anemia: iron deficiency relating to blood loss, dietary deficiency, and occasional malabsorption by the body leads to iron deficiency. Anemia of chronic diseases also associated with normocytic anemia. Hemoglobinopathies, thalassemia is a blood disorder. Iron absorption. Food source supply requires 10 to 25 mg per day. Absorption in the brush border of upper small intestine enhanced by gastric acids or inhibited by tannins and systemic inflammation. Transferrin is a protein in the cycle of RBCs formation. Plasma ion transport. Transferrin is required for the transport of iron. Plasma iron transporter protein carry less than 1% of total body iron. And ferritin is an intracellular storage of iron. Iron storage in the form of ferritin and hemosiderin. Multi-subunit protein, primarily intracellular, some in plasma, and insoluble form of ferritin, visible microscopically. Iron losses. Iron is closely conserved in a human. It is less than 0.05% of iron in lost per day normally. Very small amount in urine, bile, and sweat. Our urine also contain iron. Our bile, secreted by the liver also contain iron. In our sweat also contain iron. Cells shed from skin and intestinal and urinary tracts. Menstrual blood loss at the time of menstruation, at the time of pregnancy and lactation, iron loss occur. Pathogenesis of iron deficiencies. Blood loss occur or overt J loss, traumatic or surgical loss, failure to meet increased requirements, rapid growth in infancy and adolescence, menstruation and pregnancy, inadequate iron absorption, diet low in a heme iron. These are the pathogenesis of iron deficiency. Iron deficiency anemia, anemia of chronic disease. Iron deficiencies decrease iron availability due to the lower plasma iron level or increased phagocytosis of RBCs by macrophages, or decrease in ferritin by increase in ferritin level. Cause of iron deficiency anemia. Gynecological causes: gastrointestinal bleedings, malabsorption, pharmacological, increased demands, dietary deficiencies. Chronic disease associated with macrocytic anemia. Situation of chronic inflammation include chronic infection, autoimmune condition, rheumatoid arthritis. Rheumatoid arthritis is autoimmune disorder. SLE, inflammatory bowel disease, malignancy, chronic heart failure. Latent iron deficiency anemia. Iron deficiency without anemia. Iron deficiency does not always develop into anemia. Low iron and normal hemoglobin level 3 times more common than iron deficiency. Features of iron deficiency anemia are: depend on the degree that rate of development of anemia. Symptoms common to all anemias: polar fatigability, weakness, dizziness, and irritability. Other features of iron deficiency anemia include pagophagia, craving eyes, pica, craving of non-food substance, dirt, clay, laundry starch, glossitis, smooth tongue, restless legs, angular stomatitis, cracking of corner of mouths are side effects of iron are the features of iron deficiency anemia. Treatment include: most patients are treated initially with iron, oral iron, unless there is an absorptive problem. Dietary source include FeSO4 and BID. TID is very constipating and causing gastric distress or commonest cause for the non-compliance. 4-iron is no longer dangerous. The newer formulations such as iron sucrose are dangerous. Oral iron supplementations, which include 100 to 200 mg element iron per day, which are given in the form of tablets. In the past, recommended vitamin C tablets. Evidence now suggests that therapeutic benefit of this is minimal on an empty stomach. If gastric symptoms occur, advise the patient to try taking the supplement with food. Hemoglobin should rise by approximately 1 gram per liter per day and 20 gram per liter higher after 3 to 4 weeks. This is all about iron deficiency anemia, which cause fatigueness in the body. Our body is lack of RBCs because of lack of iron. Iron supplied to the red bone marrow in our body. Thank you for watching this lecture. Please like, subscribe, share this platform. Thank you.